Implandata is an ophthalmic device company based in Germany, and we are going to transform glaucoma care. Right now we have 12 employees and are in the phase for moving to a commercial stage company. Implandata is a combination of implants and data. So Implandata means we have an implant which acquires data and provides that data. So that's the reason behind the name Implandata. We are addressing a very severe disease, which is glaucoma. Glaucoma is a chronic eye disease. Typically, it's affecting elderly people. The older you get, the higher the risk set to develop glaucoma. So we have right now in Germany approximately 1 million glaucoma patients, worldwide approximately 80 million. And numbers of patients will increase. So the problem with glaucoma is that patients have increased intraocular pressure, which is causing damages to the optic nerve. Over time, patients will lose vision, eventually can get blind. It's a big issue because any vision lost is not reversible anymore. So the main challenge in glaucoma is measurement of the intraocular pressure. At the moment, this can be only done at the doctor's office by random snapshot measurements. Nobody knows what's going on in between office visits. Nobody knows what's going on during the day, during the night. And so ophthalmologists for a long time look for better ways to monitor and control intraocular pressure. So we have developed the iMed system by which patients can take pressure readings by themselves at home. And by that data, we enable eye doctors to apply better therapies to their patients. The technology evolved from automotive applications, from tire pressure sensors. You want to measure the pressure inside a tire, you cannot have a cable going inside the tire. So we took that technology platform and advanced it and made it so small that it can also be used for measuring the pressure inside the eye. So it's a tiny microsensor which is very safe, very reliable, which is placed behind the iris so you wouldn't see it from the outside, and which is really measuring the pressure inside the eye. And by magnetic coupling, basically it's you apply a magnetic field by which you're getting that data to the outside. And the patient has a handheld device by which he can initiate measurements and where the measurement is displayed on a display. And from that patient handheld device, it's sent into the cloud by which it goes in a database where the eye doctor has access to and also where the patient has access to. And by that information, you can really make better therapeutic decisions. So the benefits of our solution are that, instead of having 3-4 measurements a year, which are very random, you have a full picture or a full movie, so to say, of what's going on with regard of intraocular pressure. And by that information, you know early on how a medication works for a certain patient, if you have to change medication, or even if you have to do surgery early on instead of waiting and waiting and waiting. So it really enables you to make better therapeutic decisions. So the name of our product is iMate, which means friend of your eye. So we want to be really, our device should be a friend to the eye, to the patient. And so the advantage for the patient is he can take his pressure readings himself at home. What we hear from patients is it gives them peace of mind, because glaucoma is a very emotional, stressful disease. The concern getting blind is not very nice, and patients can really take the pressure readings by themselves and they know everything is fine. And if the pressure is too high, they can do something about it. So the implants are very harmless. It's a biocompatible material, gold, it's all stuff which is very well understood and safe. And in our clinical studies, we have now close to 10 years data. We hadn't had any device-related safety adverse events. So it's very safe, it's very stable, and most importantly, it doesn't compromise the patient. Patients don't feel it, they can't see it, you can see it from the outside. It's really very well tolerated in the patient's eye, so patients don't have any sensation or pain or whatsoever. It's very, very, very well tolerated by the patient's eye. So first of all, the market is really large. As said, a lot of patients, number of patients is going up. So our market calculation tells us that the market alone in Europe for our product will be somewhere in the range 100 to 200 million. Worldwide it could be even more, of course. But the economical value of our system is to enable having patients for a longer period of time in the early stage, which is less costly. Whereas patients having more progression will get more expensive. So for the payers and health insurances, we are offering the chance to really lower overall treatment costs for patients. So actually, Implandata has been established in 2010, so we are working on our product for quite a while. But now we are about to commercialize our first product, which will take place in 2019. So we will initially launch in Germany, Austria, Switzerland, and thereafter we'll expand to Europe and Asia. So commercialization and commercial traction is a very important milestone for us. The next important milestone is FDA approval. The US represents a major market for us, and for that reason we are starting to do studies and regulatory approval processes in the US. So that's another important activity. And third is to kind of really advance our technology further, to generate more products, expand indication of use of our product so that we can cover any glaucoma patient situation. So it's commercialization, US strategy, and further product advancements. So Implandata in 5 years will look different as today. In 5 years we will be a commercial company. We will be present at all the most important markets, it's global markets, Europe, Asia, hopefully also in the US. So it will be a different company. And most importantly, what drives us as management is really to change standard of care in glaucoma. What's done in glaucoma today is not up to date anymore. So we want to really provide a solution to kind of provide better care in glaucoma management. And of course, we might be part of a large organization, large corporate company, or we might be public. Here the field is quite open, but important and where we are very confident about is that we have changed standard of care in glaucoma treatment. Our goal is to really change standard of care in glaucoma. We want to provide better solutions to the eye doctors and better solutions to the patients, empowering patients, enabling eye doctors. That's what we are working hard for.